Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness, we sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. But before we dive into our discussions, let's take a moment to appreciate the tradition of tea time. Originating in England during the 19th century, tea time became a cherished ritual for British society. And speaking of British traditions, our very own Dr. Leah Merle is a British expat who now resides in the USA. She brings with her not only her expertise in mental health, but also a deep appreciation for the therapeutic power of tea time. So grab your favorite cuppa and get ready to sleep yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more...
Welcome to Tea with the Experts. I'm Dr. Leah Merle, your host, and today we are exploring a deeply important topic. It's an often overlooked topic, and it's called infant mental health. Joining me today is Mary Virginia, who is an esteemed expert in early childhood development, as well as a licensed mental health counselor in the state of Washington. And I am so excited to talk with Mary today about this subject area. She's been working in the Yakima Valley in this field for over 2 decades. So Mary Virginia, thank you so much for joining us and being here today.
Oh, thank you for inviting me. I'm delighted to talk about a very much favorite topic.
Wonderful, wonderful. Well, without further ado, I will dive into my first question. So I think by starting, Mary Virginia, what we could do is maybe you could give an overview and an explanation of when we say infant mental health, what do we actually mean?
Yeah, thank you. It's an interesting term, right? And I think a lot of us are not familiar with the idea of infant and early childhood mental health. And just hearing it, sometimes it sounds a little bit ridiculous. Like, well, how would you assess a small person's mental wellness, right? Or emotional well-being, since if they don't have language yet. So it really is about the young child, the young person's relationship, right? And the way they present in this world, right? So when you think about infant and early childhood mental health, I like to think about their social and emotional health and how they communicate that to us without words, right? Mm-hmm. So the idea about recognizing and supporting very young people's mental health is the idea of recognizing, how are they able to communicate their needs and have a caregiver respond? How are they able to navigate their world in whatever way that it looks like and have their needs met? Do they have any capacity to build soothing for themselves, to integrate into other experiences within their world, right? From one caregiver to another. And you really want to think about an infant's temperament. So if any of us listening have ever had a baby or been around a young baby, you know that they can be very different in how they present in the world, right? You can have a very slow to warm up baby, right? That we would maybe call shy, or later we might say, oh, that seems like an anxious child. It just might be a slow to warm up baby and we need to respect them and come at them a different way. Or you might have a very outgoing, kind of a happy-go-lucky baby. I've had them described to me that way, right? Where they're very adaptable to wherever you take them, wherever you go, they're just happy, they're just chill, they're hanging with their caregiver. So really thinking about the very unique qualities of how that infant is on the planet, right? And then how it communicates what it needs and wants from you, the responsive caregiver. So that's what I think about when I think about thinking about infant and early childhood mental health. What and how do we best support this little person to have their needs met? And you can sum it all up in the 4 S's. Do they feel safe? Do they feel secure? Do they feel seen? And are they soothable? Can they be soothed, right? So that's what I think of. It's kind of a basic way of thinking about infant and early childhood mental health.
Yeah, it's so simplistic, but yet so important. So thank you for explaining that. Really, I love that breakdown. And then why is it so important? Why should we be focusing on this developmental period so early in a child's life? What are your thoughts there?
Well, I think it's really important because I think how that child, that little person presents to you, the caregiver, is going to determine the quality of your relationship, right? So perhaps you have a very outgoing, loud nature and you have a very quiet, shy temperament, or a slow to warm up temperament baby. There might be a little bit of mismatch there, where you're not quite receiving baby's cues and baby is a little bit alarmed by your high, emotional way of dealing with baby. I always think about rattles in babies. Back when I was first having my first babies, everyone had those rattles. They get right close up to the baby and shake that rattle right in the baby's face. And I remember thinking, and I was a very young mom, I remember thinking, I wonder if they like that. I don't know if I would love that. It seems a little much, coming right at you. So you're just thinking about how the child is thinking and receiving information from the world, and how you're receiving information back. It's that beautiful dance of serve and return. You think about when babies first begin to smile, and also when you first notice them smiling, but the nurse or somebody or a mother-in-law or father-in-law will say, "Oh, that's just baby with gas." But you see that first smile, and you light up as the caregiver. Oh my gosh, baby's smiling at me. Baby knows me, and you feel that warm connection, that delight in their being, because now here they are. They're interacting with me. So even if it's gas or whatever it is, we want to take that in. So when they get a little bit older at 4 months and they can imitate you, you coo at them and they coo back. You smile at them, they smile back, or they smile at you and you respond. Those are just building those warm networks of I feel loved, I feel seen, I feel safe. We're connecting back and forth. And that is the foundation for healthy mental health, right? To feel safe, secure, seen, and soothed. Eventually you'll be able to do some of those by yourself. But in the beginning, a little person only exists with a caregiver, right? Babies cannot exist without them, without a caregiver. So,
No, that's so critically important, and really highlighting that importance of the primary caregiver, whether it's, whoever that primary caregiver is, it is really important. What about key developmental milestones that parents should be aware of in the first, we call them the formative years, but the first 3 years of a baby's life?
Right. And here again, it comes I would want to rely on that caregiver's understanding of baby's temperament also, as well as looking for just the ones that your pediatrician will be looking for. I'll share a story. I had a very young mom with a baby, and she came in for their 4-month appointment. I was working in a pediatric clinic at the time, and she sat down and she just looked defeated. She said, "I think my baby hates me." And baby, was sitting quietly in his chair after the visit, and I said, "Oh, a little surprised. Well, tell me more about that." And she said, I go to pick up baby and he's hard to soothe. I don't know what he wants. It's hard for him to make eye contact with me. I'm doing the rattle. I'm trying to engage with them, and he just doesn't get me. He looks away. And now I just feel like he doesn't like me. So I don't even really try. I mean, I give him his bottle, I take good care of him, but I just don't know what to do. So again, I think there where we had a mismatch of cues and personalities, baby was a slow to warm up baby, a calm, quiet baby. And mom was coming in a little bit hot, strong for baby. And so baby found it a little alarming and would look away, turn his head away. These were all tiny cues. So, mom was reading as disengagement. My baby doesn't like me. And then that sort of settled into her as thinking, oh, I must not be a good mom, right? Whose baby doesn't love them, right? So you can see how complex this is and how interrelated it is and bi-directional everything is with babies. So again, when we're looking at those beginning years of is baby, cooing and responding to interaction, again, understanding baby's temperament, this baby have a regular sleep schedule? When we get to a certain point, we should be a little bit predictable around baby will reliably sleep for a certain amount of time, between feedings and between opportunities to play. Do they have alert times where you are able to go in and have that delightful time of engaging with baby in a way that feels like just shared joy, just those golden moments? And they really feed and nurture the caregiver's soul as much as the baby is getting from it. So I think just looking at the basics around your child's routines around sleeping and eating and engagement, right? And then adjusting accordingly, so that every unique baby has its own way of being on the planet. But this can help us when you do have baby and you do have concerns or wonderings about, is this typical? Is my baby doing all right? Then the very specific guidelines that your pediatrician's office can provide you is really helpful, with an understanding that those are just, guides, right? It's not like, oh my gosh, my baby is 5 months old, not sleeping through the night. What am I doing wrong? We don't want to go that direction. We really want to think about individualizing as much as possible to your baby's, way of being on the planet. Right?
Oh, I love that you said that, Mary. I really, really do, because one of the pieces that is really important in the work that I do is talking to the parent about the individualistic style of the individual, of the child. It's really takes patience, right? It's way harder to be a parent than it is to be on this side of the seat, is what I say. It's way harder to be a parent in my own personal life than to be a counselor to other people's children. But it is about that individualization and knowing your child and being patient with yourself and being patient with the child as well, so that you know and you learn those cues. Every child is different. It's just so individualized.
And every mother is different. And I think, I don't think we do a very great job with this in that early month, what they call the fourth trimester, right after your pregnancy, of recognizing the huge, not just physical changes, but psychological changes that come with the task of taking care of a new little person. And also, if any of us reflect back on the times when we might have become a new parent, it brings up all the things that happened to you as a little person as well, or the way you want to parent or you don't want to parent, right? And so it's a really complex time that needs to have just a gentle touch and a lot of understanding around how you want to be as a parent, how you were parented, and some self-forgiveness, right? And self-compassion. If there's mismatches or missteps, the repair work is right there and is actually a way of strengthening the bond, right? Because of course we're not going to know, because they're figuring themselves out and we're figuring ourselves out as parents. So I think really recommending to young parents, to recognize, to have some self-compassion for what you're going through, and to recognize, oh, that's interesting. I responded to this crying baby with this sort of feeling. This calls up for me. That can be really helpful too, just to help define for you to be the kind of parent you'd like to be, And there are babies that can be more difficult to soothe and more challenging, right? Or a baby that has colic or any other medical need or complexity, that is definitely, you can bump up against that and building that warm relationship, right?
Yeah, no, that's really, really well said. And then what about those good mental health indicators? Like, we'll talk about the negative kind of difficult ones, but what about, let's start with the positive kind of good mental health indicators.
Yeah, I think it's important to recognize that starts developing from birth, right? From the moment little person is here. We talk about that one of the few muscles a baby can voluntarily control the minute they're born are their eyes. And we think about, well, how important people think, oh, it's their mouth or, something to do with eating. And yes, and some of those are reflexes, but with their eyes, because the moment they're bored, they can take their eyes and get them on your eyes and say, I'm here. Are you going to take care of me? So it just from the very moment they're born, we need to recognize they are developing and growing in their capacity of building themselves, right? With you, in close relationship with you, because that's how they do it. So I think taking a look at a child, we'd want to think about, are they, again, remembering your baby's temperament, but do they start kind of exploring, right? Do they feel safe and secure enough once they get to a certain age to make eye contact with other people, to reach out for something? You maybe have, if you've ever stood in a grocery store line with a baby on your shoulder and someone is cooing at your baby, and, think about how they would respond, right? And again, within that idea of, are they a slow to warm up baby? But do they turn to you because they know you're their safety, or are they one of the like giggly high babies that are reaching for the new stranger, right? We're just trying to figure out, how are they operating around the world? But how a child thinks and feels about others and treats others in his world is important, right? Because that is going to be also how he thinks and feels about himself and treats himself. And as he's growing up and developing, you are the guide for learning how to handle his emotions, right? When he does have emotions, and how to explore them safely and how to feel safe to express his emotions. I always use this example because we've all done this, or many of us have done this. I've certainly done this, where a small child will come up to you and they're like, I'm so scared of that bug, and it's just a harmless ant. And you're like, oh, that's nothing to be scared of. That's an ant. See, it's not scary. And you go over and you try and encourage the child to like play with the bug. Well, what you just did was accidentally invalidated the feelings, right? But in our mindset, we're like, oh, I don't want him to be afraid of bugs. I want him to know these ants are harmless and part of the wonderful green earth that we live on. And so we go approach that way instead of having a more responsive or tuned response could be, oh my goodness, you don't know what that is. And that's an ant. And let me come and sit with you. Would you like to sit with me on my lap while we watch the ants? Let's think about ants. And then go from there, depending on how much interest your child has in this conversation. But I think it's just so easy to think, well, this is a silly thing. Why would he be afraid of ants? I don't want him to be afraid of ants. And instead of just attuning and validating. And again, validating emotions doesn't mean you agree with them. It just means you see the value of them and you're going to say, I see you, right? You are seen and heard, little person.
I love that. It's the attunement. That's a really, really important thing between primary caregiver and child. So a lot of eye contact, a lot of body language, but also the validation too, rather than minimizing. Because we do, we all have done it at times to time, me included, where you might not be in your thinking brain, and then you accidentally, as you said, minimize the child's feelings. So it is important to be able to be more attuned to the child, right?
Exactly. And I think part of that understanding of infant, early childhood mental health is this idea that small children do feel things deeply, right? Yes. And intensely. We often hear, oh, they're not going to remember that. Children are resilient. And yes, children are resilient, but they will remember it. They might not even, we now know that even things that have happened to you before you had language are going to be remembered, right? They're going to be stored in your body in some way. So understanding that really gives us information to why a certain child might act a certain way in certain circumstances, right? So we really come from a place of recognizing, if it comes down to behavior, right? Recognizing a behavior as not linked to compliance or non-compliance, but really thinking about threat, safety, and then kind of, I guess, relationship, right? Where they are in that relationship, so that we can attune, right? And respond in really compassionate, sensitive ways that will build a sense of safety and a sense of relationship so they can co-regulate and handle emotions and situations that might be a little stressed, right? There can be adaptive stress that is positive for babies. People always say to me, babies wouldn't even walk if they didn't have a little bit of stress to get them up off themselves and using their feet and going. So I'm like, well, that does make sense, okay? If we always carried them and they got whatever they needed without us or with us, but yeah.
Yeah, that sense of resilience is, it's kind of double-sided. We can't rely completely on that, but then it does take a sense of resilience for a child to be able to grow and learn and develop.
Right. Yeah, we don't want overwhelming stress and just think, oh, that baby's just going to pull himself up by his little booty straps. Yeah. That's not what we need. We need the baby to have that sensitive and attuned caregiver, a capable caregiver of recognizing, at the times when, you can reach that, just crawl, you got it, you got your ball, and then celebrating those small moments, right? Those small moments of success. So baby feels confident and happy in itself. Like, I can do this.
Yeah, you touched on really beautifully is the co-regulation part, which, a dysregulated adult is not able to be able to calm a dysregulated child, right? It really does take the adult to be regulated, because the child is borrowing the adult's brain in a co-regulated way, right? So it does take the adult to be regulated to be able to have the child regulate too. It's called co-regulation. And I know it's just something that's so important.
Yes, that kind of you are kind of sharing a nervous system at times, aren't you? Right. And anyone who has ever had a baby that has been sick or feverish or colicky, and you cannot calm or soothe, or for whatever reason is refusing to eat, the caregiver becomes very stressed, right? And so being able to have some ways to soothe yourself, offer yourself compassion, whether you are able to say, like, I'm going to take that 5 minutes here, other trusted adult in my life, I need you to care for a baby for a moment while I get myself together, and recognize that can be really those are really stressful times, right? Instead of kind of, oh, what didn't I do? And beating yourself up, we really just want to lean into that self-compassion. All babies are unique, so I know when I had my sixth baby, people were very much like, oh, you got it. No worries. We're not going to help you. And I was like, no, this baby is brand new to me. I need all the help, all the things that you guys have for me. Just because I've had other babies does not mean I've ever had this baby. So
yeah, every baby is a new baby, right? It's a different baby. And I always think it's so not funny, but like it's so interesting how two babies can come from maybe the same parent dyad, but be very different in personality, in temperament. They may have had the same type of context of being raised, the same type of environment, but they're just so different, right?
Exactly. And doesn't that speak so powerfully to that temperament and their individual capabilities that they landed with on this planet? So having that time, and of course, when you're sleep deprived and you're coming off of your pregnancy fog and all that, this is difficult, but have that time to have some self-reflection, or have someone to come alongside you and help with that reflection. What did that feel like right then for you? I'm wondering, what did you see? What did you see in that interaction? Just really taking a moment to slow down. And I know in today's world, it feels harder than ever to have that time to slow down and really prioritize all those little moments and opportunities with your baby, to enjoy them and to have times to be curious and wonder about them, and to see all those little golden moments as well, right?
Yeah, no, that's really, really well said. The golden moments, I'm going to use that, Mary. I'm going to take that with me. Okay, so on the other side of the coin, conversely, what are some risk factors or maybe signs or indications that an infant, a baby might be struggling with their mental health for parents to be aware of?
Right. I think babies are typically as healthy as their caregiving environment is, right? So we always want to, if we care for our children, we need to just absolutely prioritize caring for our parents, right? Our caregivers. So thinking about if there are any stressors, any psychosocial stressors or social determinants of health, within the home. Are there stressors around finances or work, relationship stressors? Is there a caregiver in the home that is dealing with some mental health problems or substance use problems? Those can all interfere with those rich moments of bonding and connecting with your little person, obviously, right? I think often right now, a lot of our families really are just, necessarily in that survival mode, right? I need to get to work. I need diapers. I need food, and gas is $5 a gallon. How am I doing this right now? And so really recognizing some of those stressors that are very real, and responding with, if there are community supports, any way we can help link people to that. But recognizing that those risk factors within the home really can impact the child. And again, unintentionally, this is not shaming or blaming a parent or a caregiver. This is recognizing, oh my goodness, you're trying to keep it together in a very difficult spot, and to have the emotional capacity or emotional bandwidth available to meet the needs of this small person can be really challenging, right? So, helping parents to know when to ask for help. We're so fortunate in our valley, and we're here in Yakima, Washington. We are a community that is rich in resources for our youngest families, and making sure that they're connected to that and to know that you can ask for help. I'm hoping, that by promoting this idea, we can actually get that kind of bundled into your work with your pediatrician. So it's not something you even have to ask for. People just come along and are able to offer that support as needed, in a responsive way. to you. But so any risk factors would be those struggles within the caregiving environment. If you have a mismatch of personalities or temperaments, right? As I talked about with that young mother that was interpreting her baby as not loving her when he just had a more quiet way of being. Any sort of medical stressors, right? So if you have a baby that maybe spent time in the NICU, that can really increase, stressors in the parent and the way they're going to respond to the baby. They're thinking they're incredibly fragile, or somehow I messed up and that's what happened, or any of those wide range of scenarios that run through our heads. So I think having those screening times within our clinics to really understand if that's happening. What if you're a very young mother, or you don't have a partner, right? And you're trying to do this on your own, or you have a very ruptured relationship with your family. New babies bring up all of those feelings, for better or for worse, right? So really taking time to examine and slow down and saying to the mamas and the papas, how are you doing? I see your baby is thriving. He's here. He's gaining weight. He's looking at me. He's tracking. He's awesome. How are you doing? He's blooming. How are you doing? Over there. So I think any of those risk factors that are going on within the family, or a mismatch, right? In that baby and caregiver are not able to meet each other and respond to each other's needs.
It is so hard. It's such a raising children is hard in general, especially, when you're learning and kind of growing as a parent too, but you're charged with keeping the baby alive, right? Keeping the baby, breathing, living, and growing. And it is a huge, significant pressure. It's a big pressure. And I think one thing that you really pointed out was the access to services pieces, because there are resources out there, specifically in our valley, but sometimes people don't always know how to access them or where to go for those services. So it really is important to, I feel, as a mental health counselor, to build awareness in our community regarding that access to services, and trying to encourage people to be able to ask for help when needed. Because really that famous saying, if it takes a village, I really feel that it's true when raising children.
I know, and I'm so glad you said it like that, because our hope, as we kind of promote, and in Washington State, we're fortunate in that we have a big push for this that is funded and has legislation backing it up, that we're able to integrate this into all our clinics, all the places that touch babies and young children, right? So from your OBGYN to your pediatrician to your child care, to your ECAP classroom, we want to make sure that you are feeling your most confident, right? And and feeling that you are best able to meet your child's unique needs and your own, right? So we can't pour from an empty vessel. And so we want to come alongside that way. One universal resource that I would mention here, I have nothing to do with them financially or anything, but it's called Vroom. And it is an app on your phone that helps you, you type in your child's, birth date, and then it curates these different ways of engaging with your child in different ways throughout the day, around whether you want to have, challenging times together, or, and I meant challenge, like you're trying to teach them a skill. I don't mean some sort of hardcore challenge, but, whether you want to, engage with them in a certain playful way, or you're trying to help build a sleep schedule or anything like that. And it's just called VROOM. And I love that it's in Spanish and English right away, and super helpful for giving you ideas. I also want to explicitly call out this idea that parents get so much information from social media that it can feel really overwhelming. And so this is also a way, I think, just to kind of bring it back down. And it is, supported by our pediatricians. And it's just a really nice way to say, like, oh, I'm looking for another way to make sure that I'm connecting with a child in a way that feels, playful and helpful, right? And helping guide, again, as you recognize some of those milestones. So I do, for our valley especially, we've just had a lot of good times with that, right? Looking at it in a way to help moms and dads.
And it's a free app, right, Mary? You just go into the Play Store, you kind of search VROOM, which is the app, and then it will pop up, and it's a free application that you can put on your phone.
Yeah, and it's really wonderful. I also think about a lot of our caregivers that are, grandparents or aunties and uncles taking care of little people. It can be helpful that way. Things have changed since I first had babies, and things are changing rapidly every year, so it gives you kind of an updated way of thinking and viewing your child's, way of being in the world, way of interacting with people around them and being on the planet here with us.
I love that. Yeah. The way of being in the world. That's a really great way to put it. What about, you talked a little bit about primary caregivers and the environment of how that kind of influences mental health. Can you talk a little bit more about the importance of being a responsive caregiver? Can you maybe tell us a story that you have, or some, more kind of information about that nurturing caregiver piece and how important that is to really the attachment?
Right. Well, I think, I can share a story. We work with a lot of our pregnant and parenting teenagers in the Valley, right? And I was working with one who had, I think her child was now at 15 months, and we had not met before that. But I was sharing this idea of reading cues, and how babies and young and toddlers, sort of are communicating to you their needs that they don't have words yet. And I remember her saying, "Oh my gosh, my baby." We were just talking about how babies will turn away when they've had enough. And lots of times, we kind of like bring them back to us. No, we're continuing this, right? And she said, "I wish I had understood that baby, that was enough for baby, right? And that I didn't keep trying to amp him up. And then he would start crying. And then I would get upset that he was crying. And he was, of course, crying because we had just done too much, right? We had overwhelmed his little system." So she was thinking, I think, more intentionally now about really understanding her child way of responding. But I remember her just saying, "I wish I had known this. I wish there was some way I would have understood this as a young parent," right? And so I think about just really, if we could get the information into the wise and wonderful hands of the caregivers about what a baby is communicating. There's wonderful research out there so that we do understand in very minute details what babies are trying to say to us. And again, that idea, if you miss a cue, or you did not respond as skillfully as you could later with information, it's okay. It's that repair work coming together that builds that bond, right? Mm-hmm. But really, again, I just can't emphasize enough how we just need to kind of slow down with our babies and take a moment. And I would love to help. My favorite part is sitting with a parent, and when I can point out to them, "See what baby just did right there? See how baby's eyes brightened up and lit up when he heard your voice? That's what I'm talking about." And the parent's like, "He did?" I was like, "Yeah, do it again." And then you can see it, right? And that just feeds that back and forth, right? That bidirectional strengthening of that relationship. And it's not that you'll miss all of them, but if you don't slow down a little bit, you'll miss them. And those are just opportunities to delight in each other. Because baby is saying, "You are my most favorite special person. You are it for me." And then you are able to receive that and go, "Wow, I'm really pretty good at this. Yes, I am it for baby." Mm-hmm.
Yeah, and that part of it, slowing down and being attuned and being able to repair the rupture, because we're all going to make mistakes as parents, but slowing down enough and really having the privilege in life to be able to slow down enough with baby to be able to kind of repair the rupture. I think that's really important, because in today's westernized society, it's so easy to rush through. You've got so many things to do. You're on to A, B, C, and D of the day. It's almost like you have to kind of really focus on being present in the moment to be able to help baby grow and develop.
Yes. Yeah, you kind of need that just moment to stop. I mean, think of back. I know my doctor would always give me that advice: nap when baby naps. Did I ever listen to it? No. When baby was napping, that's when I could get all my chores done, right? Or take care of all the other little people that had demands. But that is wisdom. That is, sleep when baby sleeps. Restore yourself in some way so then you can have that moment. And again, as I like that you said privilege, because it really is a privilege in this world to have any of those times to do that, to be able to slow down enough and to take those moments. I'm also just thinking of the value. What you said made me think about the value of play. And I think we're in such a hurry sometimes, whether we're focusing on milestones, look, he can hold a pencil, look, he can write his name, versus just play is the work of childhood, right? That is what they need to be doing. And the more opportunities we can give for creative free play, right? Just hand them a bunch of blocks or, whatever you have available for you, that just gives you those moments also to see how they explore their world. And we were talking about signs of healthy mental wellness or healthy emotional wellness in a baby, that's one way when you see them making those little connections. I found this other stick and I found this rock and I'm doing this fun game out here that only I understand, in the mud. So, so just prioritizing, again, it's a privilege, but helping parents see that, play that is unstructured and, might not be driven by a certain character, although it's fine if they love Spider-Man and that's what they're going to be playing with, but, giving those opportunities for that, right?
Beautiful.
You can marvel.
Yeah, it is you said it really well, unstructured playtime. That is how the brain develops and the brain grows as a baby through those developmental periods. And so I think it's just so important for parents to be able to provide those points of unstructured play. And as adults, when we grow, we forget how to play, right? I think, we do. We forget. So babies, infants, toddlers, children, they remind us how to play and the importance of play. So thank you for mentioning that. Yeah.
Well, I see, I have the lovely opportunity to be in many of our community childcares and our ECAP and Head Start classrooms. And I love that, we have our different centers and children come and go and they are so excited when they stack the highest block tower, right? Or they made a particular track with their friend and now the car goes all the way here. These are the things to celebrate. They still practice writing their names and numbers and letters, but what I see is this richness of play in our centers right now. So I think the message is there, right? That we're getting it and we're doing it well. But just to remember, just as you said, it shouldn't stop. We should have moments of play as adults and young people as well, right?
Yeah.
Find those times.
Yeah, I'm just thinking as you're speaking, I'm thinking about those basic games that you play with children like peekaboo, right? Or clapping games or any of those type of kind of unstruck singing, right? Music with parents and children. Those are the kind of growth-oriented games that you can play with your kids to develop further.
Yes, and I think it's interesting when I'm sitting with a family in the playroom, the parents that want to come in and help decide, oh, well, no, you'll want to build it like this. No, the car will go better on a track like this, right? Because I know I always had that, like, let me help you out, buddy. This isn't going to work, right? That inclination to jump in versus the parents that are like, okay, hands off. You get to figure it out, right? You're going to figure it out one way or the other. It's going to work. It's not going to work. You'll get frustrated. We can work on what it feels like to be frustrated and problem solve. All those rich opportunities for building that are within that, right? Moments of a little bit of frustration. Again, that adaptive stress. This is stressful. It's not doing what I want. Oh, I figured it out. Oh, so helping kids that way too. I think we just can't emphasize that enough right now.
Yeah, that's how they learn, right? By doing. They learn by watching, but they learn by doing also. You can't really have one without the other. It's definitely great opportunity for brain development. I just wanted to go back a little bit to the intervention side of things. So when parents are concerned or they're seeing developmental issues or something that they feel may be wrong, or early intervention is key. We always say early intervention is key. So what are some structured things, some practical things that parents can do if they are concerned about baby's development? How can they intervene?
Intervene. Okay, exactly. So I think, again, understanding if you come in with a concern that my baby isn't engaging enough with me, right? You can be very intentional about helping baby, make that eye contact and have some sort of, just like you said, a play game, right? Where you stack 2 blocks or you bang 2 blocks or you peekaboo or you have a lift the flap book, something like that, where you can start building those skills, right? For social engagement. We would just want to, keep an eye on that and see if we're reaching some of those other milestones. If you have a child that isn't using a lot of language or you're worried that their language isn't developing as quickly as little Freddie's, you're going to come in and provide, again, some of those opportunities, not like say hat. You don't just stand there holding that, but make it playful. And so you can embed it in your daily activities, right? And again, your level of sort of enthusiasm and engagement is going to drive the child's engagement and enthusiasm about the activity. So I think being aware, and definitely if you have any concerns or wonderings or questions, you bring them to the attention of your pediatrician or your trusted medical provider. And then within many of our clinics here, especially within the Valley, but I know across the country, we have integrated behavioral health folks that can come in and help guide that a little bit more, right? So perhaps your doctor will say, oh, I kind of see what you see. I'm going to go ahead and make this referral for a speech evaluation, or a hearing test, all the different things that the medical providers do. But in the meantime, you can keep, adding to your information about what is this? I'm curious. What am I looking at? What is going on here? And really help develop some of those moments to see, can you grow those skills? Can you re-engage them in some activity? It's kind of like, so we see a lot of selective eaters or very picky eaters right now. And of course, as a parent, if you make broccoli and every time they don't eat it and you throw it out, pretty soon you're going to stop offering broccoli, right? Because they're not going to eat it. When what we know is you can continue to offer it in very small amounts, and just even them having it on, tolerating it on their plate can be a sign of like, oh, that was a good exposure to that. Or they sniff it, good exposure. They taste it and spit it out. This is horrible stuff, right? Oh, fine. You're going to keep exposing it. Where I think some of us, the inclination was like, well, I just won't offer that anymore. And so we want to make sure that we're continuing to have like exposure to a wide range of activities or foods, in this case, that they can experiment with without any sort of weird pressure. Just like, oh, put it on the plate. Oh, you didn't like it yet. All right, that's fine. So just noticing that. So I think just kind of walking that line and definitely get professional guidance around it, of how much do I kind of push into this and help promote those skills, and when do I need the work of a very skilled interventionist, right?
Yeah, absolutely. There's a lot. When do I need to invite somebody else kind of into the mix, basically? We've talked. Oh, go ahead. Sorry.
Well, I was just going to say, and I think it's important to note, if you have a concern, definitely bring it up, even if a baby is very young, because they can offer reassurance, or they can go ahead and make the referral, and your concern can be ruled out, and they can offer that reassurance to you moving forward. So I just always want to say, just if you have a question, because sometimes people will preface, oh, this is probably dumb, or I know this sounds silly. I'm like, no, tell me all the silly things, all the dumb things, all the things that are wandering around in your head that you have noticed. You are the expert in your baby. I need to learn from you about what you're seeing.
That's so true. Even if you're meeting with a pediatrician or any other type of expert, you are the expert of your baby and their disposition. You are the one that is with them pretty much 24/7. And so I think it is really important to encourage connection with the pediatrician, or between caregiver and pediatrician, and just try and kind of build that working relationship, right? So that's really important too. I know it's about fit, and it's not always a good fit, but I think that parents forget that they have the choice to choose who their pediatrician is, or who their therapist is, or who their counselor is, right? They can advocate for themselves. They know their child well.
Absolutely. And making sure that you're with someone that is promoting your voice and your understanding of that child, right? And also that is culturally aware, right? So when we talk about early intervention and early diagnosis, a lot of people are like, I don't feel real good about this idea of diagnosing small children. We're not diagnosing children, we're diagnosing disorders. And the beauty of early intervention is that often symptoms will resolve with the early intervention. The number one referral would be speech, right? You have a child that maybe doesn't articulate well or needs help with their language. And because they get early intervention at 2 or 3 versus when they enter kindergarten, you see that amazing growth. And by the time they enter kindergarten, possibly they don't need any more of that support, right? So it's just so wonderful to know that our occupational therapists, our speech language pathologists are all available here to help us understand what is going on and have specialized skills and talents, that they can share with us,
Yeah, absolutely. Well said. It is really important. I know you and I have talked about this before regarding the encouragement of early intervention, because it doesn't mean you fail. It doesn't mean you've done something wrong. It means you're aware of your baby and you're aware of what's going on, and you're tuned into your baby to be able to reach out for support and resources.
Right. And there's, we talk about that wonderful window of opportunity between 0 to 3, but that window never closes, right? We can always look at it. That window is permanently open for us to help support you in whatever you have worries or concerns about. I would just love to help remove some of the stigma around this, right? And there's stigma there for good reason. In the history of mental health and wellness, there's been much harm done, right? So we need to recognize that there's a reason why people don't bring this up, whether they feel judged or have had harmful experiences with certain systems within our communities. So I recognize that. So finding someone that you trust and that you can say, this is what I'm seeing, this is what I'm worried about, and then can amplify your voice to the correct professional is really important. I just feel like that's so much more helpful than sort of a let's wait and see approach. And sometimes you see that within your family. I know one of my children who needed early intervention for speech, the grandmas were very much like, oh, he's just going to talk later. He's the fourth baby. He doesn't need to talk. And even the doctor was saying that to me. And my mommy gut was telling me, no, this little person's going to need some extra help around this. And was able to thrive with those supports in place. So, I just, especially here in many communities have these resources, ask. Advocate for your child.
Advocacy is really key. I think that's actually one of the parts of being a parent is being able to know your child well enough to be and have that confidence to be able to intervene or advocate for them. Yeah, well said.
Yes.
And I know you mentioned culture. What about cultural differences? And how do they impact approaches to infant mental health and caregiving practices? What are your thoughts there?
Well, I think you would need to be have a deep understanding of the culture of the family that you're working with, not just their culture, but their family culture as well. Mm-hmm. And I'm hopeful with the program, Dr. Leah, you'll be doing at Heritage that will get more representation within our community of people of color that look like our community, right, and can do this. Historically, it's looked like older white people like me coming in and telling you what might be going on, and without a real good understanding of what is going on within the culture and within the family culture. So I think just being really mindful of that, and if available, reaching out to represent people that represent that culture so they understand it. I think about maybe in some families, we think, oh, language is so important. You got to talk to your baby. You got to read your baby. You got to talk to your baby. Back in the 90s, they had all those, they had baby videos that they would have you watch, your baby would watch and learn things. That's not particularly necessary, but you can see in different families, different cultures, the way they promote a baby's feeling of safety, security, being seen and soothed. And it might not have as much language, right? So I still want to encourage a language-rich environment, of course, but you really want to be aware of that and understanding of that when you're looking at something. And I think what's great about infant early childhood mental health is it really is a strength-based approach. The medical model will always kind of sit with some deficit-based approach, and that's what they have to do, right? That is how it's designed. But we can come in and say, oh, let's look at everything that's going right. I see this place right here, maybe with language we want to work on, but look at all this wonderful exposure this child has within his family culture of having this lovely mix of caregivers that respond differently. Fathers respond differently to mothers, grandpas and grandmas and aunties, everyone coming together. So really getting a deep understanding of what that looks like and how that child operates within those caregiving relationships is so helpful, to understanding that.
Yeah, and we're really, really beautifully talking about cultural differences, right, within family systems and how one family system is supported by one culture is different than another. And I think in westernized society, what we do is we kind of blanket it. We say, well, this is the way that it should be for all individuals, but that's not true, right? We have, there are influences of Eastern philosophy as well as Westernized philosophy and as well. So I think we've got to kind of really individualize the family system that you're working with. Now, this takes a lot of training, a lot of work. So I wanted to just pause and ask you if you could explain the training program that you went through at the UW. Would we be able to talk a little bit about the specific training that you went through, Mary? Because I think it's such a beautiful training program. I refer so many of my interns and associate counselors to this program if they want to specialize in infant mental health. So maybe just talk to us about that for a little bit.
Yes. It's called the ACT program. It's through the Bernard Center at the University of Washington. And Dr. Nucha Isarong is the one that designed it and is the primary director of it. And really what it is it's 15 months of just embedding yourself in understanding of attachment, early infant development and early childhood development. And we hear from all sorts of lovely experts from all around the country. Dr. Arietta Slade from Yale, people, Dr. Ed Tronick, people who write these books that I could not believe I was going to be listening to in a classroom setting. And then they have a very robust focus on the culture piece, right? Recognizing that this has sort of been missed previously in this westernized idea around mental health. So that they're very focused on building the workforce for us, obviously within Washington State, and making sure that for every parent, that we have someone like this nearby that can help support, if there's need. And again, I always think of it as being promotional and preventative. So I would like to not wait till the need is here. We don't wait till the wheels fall off to be hopefully invited alongside to help support. The beauty of the program, one thing that I found so helpful was we spent a year watching an infant just through a Zoom screen with no comments. We just sat for an hour, and these lovely families allowed us to watch their baby for 1 hour with no comments. We're not talking to the family. We're not doing anything. They're just going about their business with baby, or baby might even just be sleeping there. And we just recorded everything we observed, so we could start heightening our understanding of how babies operate, what we observe, and also what it brings up for us, right? Thinking again about that parallel process, oh, I wonder why mom responded, or I would have, if you had an immediate thought, like, I would have done that differently. You're like, oh, that's curious. What's that about, right? So it really gave us the time and experiences to do that in a really intentional, deeply compassionate way. So it's just an amazing program to help us understand our most vulnerable people, right?
Absolutely. So if there's anybody out there listening to this podcast today and they are interested in training in infant mental health, then the Barnard Center at the UW with Nusha is the program to refer people to. I refer
yes,
lots of people.
Could you remember the name? It's Advanced Clinical Training.
That's
right?
it. ACT.
And the other lovely part about it was we had occupational therapists, we had therapists, we had teachers, we had program directors. Yeah. You didn't have to be a clinical, worker to just benefit from this so much, so intentionally. Yeah. So just a real commitment to the rights of our youngest folks.
Yeah, thank you for sharing, Mary. I really wanted to highlight that beautiful, fantastic program. So thank you for sharing. And I do want to talk a little bit about mental health and how impactful mental health is from a primary caregiver perspective. So, I'd like to just kind of delve into mental health a little bit. And can you kind of talk about the impact of a parent or caregiver's mental health and what can they do and how impactful that is on a child, but what can they do to manage their mental health?
Right. Yeah, and I think, again, I would love that someone would come alongside you, at the hospital even. And so maybe you had a difficult birth, or maybe the birth didn't go the way you planned, or maybe baby had to go to NICU for a moment, right? So really recognizing how that could impact that attachment and how you're feeling after the birth. And so that we could have someone come alongside. And thinking about mental health, you'd want to check in. I know in many of our clinics, they do the Edinburgh screener for postpartum depression. Mm-hmm. And my favorite one ever, it was a young mom of twin boys. Mm-hmm. She was there for their 6-week checkup. We gave her the Edinburgh. She literally just wrote on the top, I have not slept in 6 weeks. I have no idea what I'm circling right now. And she gave some random circles. And I thought that was so interesting. Like, this screener really isn't helpful in those moments sometimes, right? So fortunately, within that clinic, we were able to have someone come in alongside and chat with her about what the needs were and really get some help. And she was having a lot of struggles around feeding and sleep, as you can imagine, with 2 twin babies. Wow. So again, just from the get-go, somehow helping to remove that shame and stigma and saying, I'm actually not doing very well. I know I would always try and clean myself up, comb my hair that morning to get to the pediatrician's office. Baby was in their best outfit, but, it was rare for them to stop and look at me and say, but now how are you doing? he looks great. How are you doing? So I think we've changed in that way, but I would love to just keep promoting that. And so that families can feel like they can say, I need help.
Yeah.
This isn't going well.
Yeah.
And avoid any sort of shame or stigma, right?
Yeah. That's the piece. I mean, the stigma regarding now you're a parent, you should know what to do, right? Babies, children don't come with an instruction manual, right? You have to learn as you go. But I think reaching out to support systems and to other folks maybe who have been through, not the same, but similar to you. And it's for our primary care physicians to, I know you're talking about the system. The system is much better at picking that up now, but I work with a lot of primary caregivers in the postpartum period that feel ignored. They feel like they are going under the radar. They don't know what's wrong with them, and they feel they're at deficit as a parent, and it's postpartum depression. It's classic. You open the DSM and they hit all of the criteria of postpartum. And so this feeling of talking and just sharing what you're experiencing and what you're going through, I think is really, really important. Again, intervention is what you're talking about. Intervention.
Early intervention with a trusted caregiver. And in order to build that trust, I think you do have to feel that you can be vulnerable and be authentic to them, and that you'll be safe, secure, seen, and soothed by the provider, So it's not just for children, it's for all human beings need this. And so I think of, some parents are able, again, this is a privilege, but are able to go in and meet their pediatrician before their baby is born. Make sure you talked about being a good fit, making sure that's a good fit and that you feel comfortable and that they, you feel like you can be yourself and, say what's going on and what you're expecting, or if you're disappointed in what happened somehow during the birth process, or all the ways we beat ourselves up afterwards about different things that happened. So really hearing that birth story, so that fourth trimester time, I wish we had more of an emphasis or some way we could really grab that. We do have the nurse family partnership here, which is lovely. That comes along first time parents, but only first time parents, but we do have some other programs through maternal health that can really help support you. But I would love to make sure that every pregnant or thinking about being pregnant person knows that those are available to them, right? And then we can help remove that stigma and shame, and we can ask for help and get that help early.
Yeah, no, that's really well said. Really well said. What about when an infant does receive early intervention? What are some signs that indicate that their mental health is improving, like in an encouraging way? What sort of signs do we see?
Well, I think usually we hear it from the caregiver, and we can see it in the child as well. So say, for instance, a child that was struggling with using language has some more words to be able to communicate their needs. Mm-hmm. You would see less temper tantrums, right? Or meltdowns because they're so frustrated they can't tell you what they need and want, and you're standing there and you're trying to understand. You would see the parent feeling more confident and more responsive, like, oh, I know exactly what he needs. He's got this new word for milk, or, he takes me by the hand now and shows me exactly the toy if he's frustrated with trying to say it, and we know how to communicate better. So again, that bi-directional way of the serve and return is matching, right? So you would see, I think, babies that are less stressed, and stress can look like anxious babies, so like clingy babies, crying babies, hard to soothe babies with frequent temper tantrums or meltdowns, maybe even a baby that just kind of is a schlumpy baby. We talk about babies that might look like their eyes are not bright, or a toddler that just isn't really willing to come in and engage. So you would see that change. So again, if the caregiver feels more confident and the baby feels more confident that, oh, the world understands me now, and I have a sense of efficacy in my day, to get my needs met, then that's going to just, it's like a rising tide lifts all boats, right? Baby feels better, mama feels better, child care provider feels better. Everyone feels better with the little person able to say what they need, or having someone kind of interpret their cues. Maybe it is something that you need that other third person going, what I think is happening here. Let's try this, right? And then adjust as needed. Mm-hmm.
Yeah, beautiful. What are everyday activities or practices maybe that parents can incorporate to promote, adaptive, balanced infant mental health?
Yeah, I think first of all, as much as possible, we all like a predictable routine. That does not mean we are in lockstep and we can never have any flexibility.
Yeah.
But, if you wake at a certain time and you have feedings at a certain time, that's all good, right? Learning again from your child's response when it's enough, like when, so that you're able to see. One thing I've noticed recently with a lot of the 3-year-olds I'm working with is when they start getting super silly, we're about to lose it, right? Like, something that was funny for a moment, like, oh, the blocks fell down, he, they landed on that person upside down. And then all of a sudden it just keeps escalating. I'm like, oh, here we go. For many of us, once we have a big emotion, even if it's joy or playfulness or silliness, all the emotions, and they have trouble with the regulation, right? And so we're there to co-regulate. So being proactive and pre-correcting for those moments so you begin to recognize that pattern is really helpful. I think knowing if there is something that is soothing to your child is kind of a go-to. Like this always works. I had a parent once say, I don't know why, but this one song, it was the Sunflower song, for their child, always soothes them down, even in a car. This was before the child really had a lot of words. He was just babbling. I'm like, wonderful. I'm so happy that you noticed that. What do you think it is? So we didn't know if it was the beats per minute or the actual words, or that mom felt less stressed also driving baby, listening to that song, right? So who knows what it all was, but it all benefited baby. So again, I think recognizing that during your day, have those moments where you can do a little bit more, right? Recognize when to back down. And you can notice sometimes babies and small children have physical symptoms of stress, right? They might get flushed, their hands might get tight, their jaw might get tight, or they start running around the room. You're like, oh, okay, we went a little too far. We're going to have to bring it back down. Do you also talk about, Dr. Leah, upregulating and downregulating?
That's right.
And being able to move, right? Move between those states.
Yeah. We're always thinking about the nervous system as well. And, what I always go back to is the individual nature of the child. We've talked a lot about that, but just highlighting, like I can use my child, my middle child as an example is, raising different children in family systems. They like different things, and sometimes babies are overly sensitive or they are super, super sensitive. So I remember with my middle kiddo is trying to rock her to sleep. She did not like to be swaddled or she didn't like to be chest down. She wanted to be up and out with her arms and legs free, right? So that took me quite a few nights of sleeplessness to be able to get to that point that she did not want to be kind of swaddled at all. And then there was you were talking about baby songs. There was a baby song, what is that called? That Rockabye Baby, Rockabye Baby? Could not put that on at all because she would end up screaming. She would cry and she was so sensitive to that. I tell her about it now that she's 13 and she's hysterical laughing, of course. But when she was a baby, that was something that I had to learn because it just didn't work for her. So those are the things, the individualization are really important.
Right. Just really fine tuning what works for your baby, because that goes against all the advice that experts tell us, right? Babies want to be swaddled. They want all of that. And you're like, not this baby. This baby did not want that.
No. Don't kind of fasten her in. She absolutely hated it. So,
well, and it's what I love is when you share those stories of what they were like as infants as they get older. And then you can recognize some of those characteristics remain, right? Around, I don't know if he's a free spirit or a free thinker or whatever, but, you just kind of like, oh, I see how this all worked out. I see.
Oh, yeah. You're right.
So it is delightful to have that ability to be able to reflect back when they get older, right?
Yeah, no, absolutely. You're absolutely right. What about, we're kind of getting towards the end of our interview today, but I'm wondering about maybe a personal experience or a story that you can share that really highlights the impact of focusing on infant mental health, because you do this on a daily basis. And so just maybe encapsulating one story, a part of a story that really encapsulates that.
Yeah, I have a good one. He's a little bit older. He was 4 when I first met him. But he had experienced a lot of change in his caregiving environment and was now in the care of a grandparent, along with some cousins and one of his brothers, right? And he was a very loquacious, very talkative little guy, right? And very expressive with his language. And a lot of his language was cursing, unfortunately, right? So what was happening is caregivers and family were so focused on the cursing, that they were trying to stop that, as they were preparing him for kindergarten, that we were sort of missing the attunement, right? What was he asking for under that? And I remember the first time I met him, I just walked into the classroom. I wasn't even actually there to observe him, but he came running over and leaped on me. And he said the B word, and he said, "Read me a book." And he's like hugging onto me. And I thought, oh, and I saw the teachers go, oh, and everyone just kind of stopped. And I thought, okay, well, he wants me to read him a book. Let's so I was like, all right, where are we going to read a book? And he's like, over here on the comfy couch. And he led me over there, and we sat down for 20 minutes and read a book together. And I remember thinking, I wonder if I hadn't had these years of training, if I would have also responded like, now, how do you ask nicely for an adult to read a book to you, and started some correction, way of going down a line versus attuning to his need, which he was really saying, I would like someone to snuggle with. He definitely was, needed some moment of comfort and closeness and connection and, a sense of belonging. And what was lovely about it is, once we sort of shifted our view, and we didn't respond so much to that language anyway, he just naturally started using it less, right? Even though in his family it was still sort of used very casually. He had older cousins and all the things. He was starting to recognize, I don't use this in school, and I don't use this to other people I love. That's not a term of endearment, actually, so it worked out really well. But I just remember thinking, I'm so glad I was able to have enough self-awareness to go, okay, I got to respond differently here if I want to build a relationship with this little person. And I do, and so it turned out really well. And just working alongside his caregivers as well, we were able to kind of fade that out and for them to really delight, because everyone was so focused on that. It was so hard to delight in this brilliant, just radiant little human, right? But definitely had some early adversity that had shaped some of his ways of being, and so we were able to really support the family and made that transition to kinder much smoother, and just probably made him feel more loved and appreciated all around, right?
Yeah, that's the piece, and kind of meeting what you're talking about is meeting him where he's at and not focusing on the negative with discipline first, but understanding the experience and being able to join with him a little bit more. So, wow, what a beautiful story. Thank you so much for sharing, Mary. I really like not my last question, but one of my last questions are there any exciting developments or research in the field of infant mental health that you'd like to share, particularly that you are interested or excited about?
Oh gosh. Well, I think just really interested in learning to read really well the cues of very young infants and really being able to help the caregiver understand that. And also I would love to think about focusing on fathers and fathers' importance in this work, right? And I think sometimes they feel left out of the conversation. And I really see some robust research and information, especially because they do respond differently. And just, we were talking about how children can have that flexibility. Oh, with dad, this works, and then with mom, I'm different. That is a strength, right? And so really helping to recognize that we make sure dads are prioritized. Here's another story. I had a young dad who was caring for his children as a single dad, and we were giving him some resources, including WIC. And he said, well, I didn't think I could apply for that. It said women, infant, and children. So even think about the intentionality of naming programs to support families.
Right.
This poor young father did not think he could apply for that, as he was not mentioned in the wording for it, which makes a lot of sense. So I hope we just have a much more inclusive way of reaching out to our families. And I think I'm also excited about the way of understanding family diversity, right? If you have two mothers or two dads or just a combination, that we can respect that and move into that in the way that they need to be to feel safe, secure, seen, and soothed within the way they're providing their parenting.
Yeah.
And so that's a good movement that I am seeing going on right now.
It's definitely going in the right direction. And so thank you for highlighting that, cultural developments as well. But I think one thing that I'm super excited about is the role of genetics and epigenetics in this field, and especially regarding environment and shaping mental health. And then also the advances in neuroimaging and neuropsychology as well as developmental psychology are really providing deeper insight into how early experiences are affecting long-term outcomes of health, mental health, which I think is just helping our research as we move forward.
Right. And I think that, that's nice when you think about the robust research connected with the clinical work, right? So it doesn't just feel like, sometimes people say to me like, oh, you're just a therapist, so you see everything as, goo-goo kindness. And I'm like, well, actually, this has like scientific research to back it up. We're not just out here, saying things. I think you're right to highlight that the important part that research and early understanding of, sort of the neurobiology of attachment, right? And what that looks like and how we've come to understand it in the last 30 years.
Yeah.
So.
Oh, I love it. I could talk to you all day, Miss Mary Virginia, but this has been such an enlightening conversation. And so I want to thank you for being here and talking about this area that I'm so passionate about. I know we connect on that. But before we actually close and wrap up, is there any final advice that you'd like to share with our listeners, or any kind of final moments of expertise that you'd like to share?
I think really everything that we've been talking about is really, making sure our caregivers can trust their instincts around situations, right? And can come and get help if needed. And also for them to just slow down and learn, or spend some time learning how to delight in being a parent, right? Even when it feels really hard. And that's where we're here to help if it does feel really hard. Mm-hmm. So I would just love people to feel hopeful, right? And then to help so that we can amplify those moments of joy and delight. And, the grown-ups need that too. They need someone saying, oh, good job. I saw what you just did right there. I always loved coming away from the pediatrician office sort of feeling like I got a gold star maybe, so it felt good, right? Yeah. So that is what I would just promote. Just again, promote that parents' awareness and then self-compassion.
Oh, I love that. Absolutely. And thank you for being here to emphasize the importance of early relationships and also the powerful role that they play in shaping an infant's future, a child's future. I think for me, investing in infant mental health for the future is really a part of an importance of well-being for our society. So, to the listeners out there that might be listening, don't hesitate to seek support and guidance if you have concerns or thoughts about your child's development. It really is important to reach out for support. So again, Mary, thank you so much for sharing your expertise with us today. And thanks to our listeners for tuning in. Really remember to take care of the youngest amongst us. It's one of the most important things that we can do for our collective future. Be sure to subscribe to Tea with the Experts for more insightful discussions. And then until next time, take care of yourselves and each other. Bye for now.
Thank you.